We're looking at some health matters now. Patients are being turned away from the Mtimba clinic in Mpumalanga following an attack on nursing staff. Labour Union now has withdrawn its members from the clinic, citing safety concerns. Armed robbers accosted nurses and robbed them of their belongings, including cell phones. Plans to safeguard health centres in the province are currently underway. And moving on to this, how the NGO Right to Care is encouraging men to circumcise this winter to protect themselves and their partners from sexually transmitted infections. The organisation says circumcision can help reduce the risk of transmission of HIV, for example, by as much as 60%. Let's have this conversation now and speak to Dr. Nelson Igaba, Senior Technical Advisor at Right to Care. Dr. Igaba, thank you so much for your time. Now, June is Men's Health Month, and it's quite an important time to be having this discussion. When it looks at the call for men to circumcise, how's the response?
No, thank you very much, Bongiwe. And it's great to be back on your show. And thanks for prioritizing such matters of men. By the way, June is Men's Month, and I think it's a right platform for us to start this discussion. Going back to your question, Bongiwe, the response hasn't been as desired as would have loved it to be, because we are lagging behind in achieving our targets. If you look at the global picture of HIV, epidemic in our country, we have close to 7.8 million people who are believed to be living with HIV in our country, and 38% of those are men. And we are still lagging in achieving, our targets of reaching the 95. And when you look at the people who are lagging behind, it is the men especially. And this is because of very many other reasons. So we would have loved the response to be better than what we are seeing.
Please, can you elaborate on these particular reasons? Because as you and I are chatting tonight, there are some men who are probably saying, this is not for me.
Yes, we really know that men have a lot of issues in terms of seeking health services, and among some of them, it's fear of pain. The other one, of course, is issues related to masculinity, being found at a clinic or being seen going to a hospital. Some men perceive it as a sign of weakness. And then you have issues related to the system where, there is, congestion, long waiting times, and other, staff-related issues. But above all, men live risky health behaviors, and they should be really prioritized in terms of health services, like other sections, of population have been prioritized in some other programs.
How then do we begin to change this? Because when you think about the fact that, for example, there would be an older man who's watching saying, but should I be circumcised? I'm older now, so there is no need. And you also then are hearing of some of the reasons that you're placing here with us tonight on the show. How then do we begin as a country to change this particular thinking?
You're doing a great job by creating this platform for us to talk. That's the first way we can change it. And this is why we are calling upon men to step forward and take the benefits of getting circumcised despite your age. Because the benefits, like you said in your introduction, when you get circumcised by a medical practitioner, you can benefit from, reducing transmission of HIV by 60%. Also, circumcision has been proven that it reduces transmission of certain sexually transmitted infection. And recently we had media reports that there has been a spike in sexually transmitted infections in our country. So there are really critical reasons why men should come, because the health benefits are really lifelong, and as circumcision is just a once-off procedure. So men should really go for circumcision.
Let's speak to a man who says that, but I'm worried that if I circumcise, my sex life, for example, could be affected. Let's speak to someone like that.
Yeah. We've had a lot of myths related to circumcision. Some people have told you that when you get circumcised, you lose your sexual ability. When you get circumcised, there will be severe pain. You should only circumcise in winter. You should only circumcise, very many myths. But here I am to break the myth and the misinformation. Circumcision is a very short time procedure. It takes 15 to 25 minutes. You will not feel pain because before the procedure is done, you will be injected a drug that will numb, your organ, if I can use that word. Then thereafter, you should be able to resume your work within 2 to 3 days, and within 6 weeks, you should be fully healed. And there is no difference within your sexual functionality or sexual pleasure. On the other hand, we have had people, anecdotal report from women who think that circumcised men have better sexual pleasure than others, but that's anecdotal. But all I'm trying to say, there will be really no change in your feeling after circumcision. You will enjoy more benefit rather.
Dr. Igaba, I want to go back to what you say is anecdotal, because some of the cultures and some women do say that for them, they don't want their men to be circumcised because they do enjoy the pleasure better when they're not circumcised. Other cultures would say that no, the skin needs to stay on. You do not need to remove it. So how do you contend with that information?
Yeah, indeed. I think you're bringing a very contentious topic there. And for us, we follow science. And there is really no proof in terms of science that shows that you lose your pleasure after circumcision. Yeah, so we'll follow the science, and that's what will inform us. And the science has informed us that circumcision prevents you from getting HIV by 60%. And it prevents you from getting STIs. And I think that's why we are implementing it at a high scale. And by the way, Bongiwe, to remind you, South Africa has circumcised more than 5.6 million males since 2010, since the program was implemented in the country. So you can really see there's been a milestone. And as per 2017, we had averted close to 85,000 HIV infections, which is a big deal in terms of prevention of infection in the country.
Those statistics, especially of HIV, are they telling us that there's some complacency there?
Yeah, I mean, I think what we need to look through is the behavior and communication, as we had really started when we started, fighting the epidemic. I think there has been the drama has gone a bit numb in terms of, encouraging people to live healthy, behavior, having healthy sexual behavior and other lifestyles. And I think we need to go back to the basics, whereby we need to encourage people to have to reduce, the number of sexual partners, to use protection, to get tested, and all other prevention modalities that are out there, like pre-exposure prophylaxis, post-exposure prophylaxis, and many others. I think we really need to drum those up so that we are able to end HIV by 2030.
Briefly then, before I let you go, when they come to your facilities, there's also other screening that they do get to then benefit from. Let's talk about that.
Yes. So when a man comes to our facility, by the way, before, if a man would like to come to our facility, you just need to call a toll-free number 082-808-6152 or send a please call. You can request transport. They will come up and pick you, bring you to our facility. When you reach, we'll assess you. What we'll do a screening from your head to your toe to see if you're fit for the surgical procedure. If we find you have like high blood pressure, if you find you have like diabetes that you are not aware of, we'll ensure that we channel you through the system and you get treatment. So you find many men, they come for circumcision and it's their first time. At the age, for example, of 30, is their first time ever to step in a clinic. So we take this opportunity to really screen you, your health status, and give you the appropriate referral to where you need to get care. So take the opportunity today, come to our clinics. We have like more than 350 clinics around South Africa. Anyone 15 years and above, call number 082-808-6152 and we'll give you a high quality, safe service.
All right. Thank you, Dr. Igaba, for your time this evening. Hopefully the men respond to this particular call. I still need to work on some of the positions here in studio. I was receiving gasps as I was asking some of the questions from my colleagues here. So definitely a lot of work needs to be done. But thank you so much for your time. Do appreciate it.
Thank you.
That was
I'll come by.
Yes. Please do stop by. That was Dr. Nelson Igaba, the Senior Technical Advisor at Right to Care.